Biomedical waste. Biomedical waste or BMW containers should have biohazard warning. Every BMW generation area should have segregation posters provided by BMW collectors. Spill kit. Every hospital should have a spill kit. The spill kit should contain hand gloves, masks, absorbent cloth, mop, brush, yellow bag, sodium hypochlorite solution, etc. The list of contents should be pasted on the lid. Mercury Spill Kit. The kit contains everything you need in the event of mercury spillage, like personal protection equipment dust mask to protect the user from chemical dust, 2 pairs of vinyl gloves that are allergy-free, waste mercury bottle, leak-proof and shatterproof, manipulation items, scoop, brush and syringe for handling mercury, absorption systems, sulfur or calcium hydroxide powder for use on vinyl or other non-absorbent floors, alloy wool absorbent for use on all surfaces, particularly carpets, bedding. Needle stick injury. In the event someone gets a needle injury, then immediate action. Allow bleeding, free flow, no squeezing, and then wash with soap and running water for at least 4 minutes. Clean the site with antiseptic like 70% alcohol. Take blood for virology, that is HIV, hepatitis B, hepatitis C from the injured worker. The source, if identified, should also be tested for HIV, hepatitis B and hepatitis C. Follow-up. If the status of the patient and healthcare worker is unknown and immune status cannot be obtained within 48 hours, then give hepatitis B immunoglobulin, hepatitis B vaccine. If the healthcare worker is HBV immune, then no further hepatitis B vaccine is required. But if HBV susceptible, then treatment with immunoglobulin and vaccine. Complete the course on the hepatitis vaccine. Follow-up serology 6 weeks, 3 months, 6 months and 12 months. No zone. Pets should not be allowed on hospital premises. Ensure that stray dogs and cats are driven away. Posters of no smoking or no tobacco zone and no pets should be displayed on all the floors and staircases. Emergency codes. For a nursing home level, normally following 4 codes are applicable. Code White for violent patients or relatives. Code Pink for infant or child abduction or abuse. Code Blue for cardiac arrest and acute medical issues. Code Red for emergencies arising out of fire. Hazardous material. A hazardous material is any item or agent that is biological, chemical, radiological and or physical that has the ability to cause harm to humans if they are exposed. Hazmat materials should be identified through hazmat sticker. The summary of the material safety data sheet, popularly called MSDS, should be printed and displayed at the nursing station. Staff should be trained to handle hazmat items with care and first aid in case of accidental exposure. Keep hazmat liquid containers in the tray. Incidence Book. There should be incidence books which should be numbered and kept at various locations. The staff should be encouraged to write any irregularities they find or any incidents they witness that shouldn't have happened but happened. Please see the video on Incidence Book. Repair or Tolerance Book. The concept of repair or tolerance book is to record trivial irritant issues which are not big enough to attend immediately, however, need to be rectified at some time. The following events can be entered into the tolerance book: faulty equipment, broken glasses, noisy doors, windows not closing completely, etc. All the staff members should be explained the importance of the repair or tolerance book. Please see the video on Incidence Book.